Mr. Jones, MLA Jones, is representing his constituents. He has every right to do that, and I think he makes a reasonable case. He's been very consistent in pointing out that there are an extremely low risk of severe outcomes for children and youth coming from COVID-19, but that we have been facing a very serious mental health challenge amongst younger people whose lives have been upended by the COVID era and public health restrictions. So I think it's important to have that perspective in the debate as we find the right balance in reducing viral transmission and reducing the pressure on the healthcare system. I think Matt's basic point is that there is very little hospital pressure coming from people under the age of 18. Right now, we have one Albertan under the age of 18 with COVID in intensive care. And that has been pretty typical of the past 20 months in terms of the very modest hospital impact of infections amongst children and youth. As you know, the regular seasonal flu poses at least a greater, and some evidence is it poses a higher risk for hospitalization and severe outcomes for children and youth than does COVID-19. We have had in 20 months zero COVID-related deaths for people under the age of 18 in Alberta. So those are facts that he is pointing out. I think he's got every right to represent that perspective and appreciate his input. At the end of the day, the COVID Cabinet Committee has to look at all of the different factors, take on board the expert advice of the Chief Medical Officer and her team as we seek to strike a balanced approach, and we'll continue to do that.